So I wanted to touch a little more on issues in ethics and privacy. So I know we've talked about HIPAA, Health Information and Portability, and Accountability Act. So um, with healthcare informatics, we have so much more access to the internet and to information. And we have to be careful with how we use it and why we use it, to make sure that we are protecting our patients' rights and ourselves. So health informatics applications, there's appropriate use, user, and context. And I'm sure many of you have gone through exhaustive amounts of HIPAA training that talks to you about all the crazy rules and laws and regulations and things that you have to do in order to protect your patient information. And the same goes with data sharing, electronic clinical and research data, especially research data, keeping information de-identified and protected. And then, of course, how computer programs are this very beautiful documented tool that can be used as potential expert witnesses. So with this increase of technology in our healthcare system, our accountability and patient safety protection on health information is at its highest importance. So like this presentation says, the move to widely accepted electronic medical records and e-health applications is accelerating. And so this is great, right? We can share information. You know, when I'm at work, I can get on Care Everywhere and I can access information to any other Epic place with the patient's information. And there's some highly private, sensitive information that is double protected. And so we need to increase our protection around these highly private and sensitive information to outsiders. So there is a strong exception that this information will be used only in the context of providing healthcare, and otherwise it's kept a secret. So there's the Code of Ethics for the American Medical Association and Federal Privacy Act of 1974, not 3, my bad. And eventually security and privacy of healthcare information is a people problem. So privacy generally applied to people while confidentiality is best applied to information. So keeping ideas private is actually the reason why people don't have that privacy is because of errors that we make as people. And confidentiality to information is more of an information informatics type problem. So human values should govern research and practice in health professions. Healthcare informatics, like other health professional, encompasses issues of appropriate and inappropriate behavior. Students and practitioners of health sciences share an important obligation to explore the moral underpinning and ethical challenges related to their research and practice. So what is health informatics ethics? Well, it's encompassing ethical issues resulting from the use of technology in managing healthcare information. And you're kind of like, okay, great, Denise, is this another lecture on HIPAA? But it's not. There's a lot more to it. We have a lot more grab and reach. Oh my gosh, Denise. We have a lot more reach with our knowledge and our power because of all this access and technology. And so we actually have to have a level of ethics that is specific to this area. So informatics now constitutes the source of some of the most important and interesting ethical debates in all of the healthcare profession. So one, we look at our code of ethics, like what resources do we use to refer to our ethics? So there's the Code of Ethics. We have the ANA Code of Ethics, so the American Nurses Association, the AMA, the American Medical Association, the WHO Code of Ethics, and the IMIA Code of Ethics. We use case studies to help us solve confront certain ethical conflicts and situations, and the cases are applied for jurisprudence. So we use that as back information to set precedents to certain situations. Ethics committees and personnel. So this is when organizations can have committees and train staff to discuss and resolve ethical issues. These may include ethics boards or ethic professionals that are contacted for consultation. And there's actually a master's degree in healthcare ethics that is a very lucrative, if for lack of better words, masters to get, just because the area of ethical conflict increases tenfold with every decade that we pass because of just the growth of technology. And then informal discussion. So stakeholders in health informatics. So it's important to identify the stakeholders involved in health informatics setting because ethical conflicts arise as a result between interactions of these stakeholders. So you obviously have the patient, you have the healthcare professional, you have the institution and the employers and the employees of those institutions. You have society, you have yourself, what you owe to your profession, and then actual regulators of laws and practices. So the electronic medical record. Medical records contain a lot of information about patients. So you have height, weight, blood pressure, notes about flu, cuts, or bones. And I mean, I know I want to keep my weight a secret, but if that gets out, it's not going to hurt anyone. But there's a lot in there, right? There's information on fertility and abortion and emotional problems and psychiatric care. What if you're in a job where if they knew you had an emotional problem, they might not want to keep you around much longer? And then also, well, where's the line in that? What if somebody works with small children and they have an anger disorder? Is that protected information from their employer? Sexual behaviors, sexually transmitted disease, HIV, substance abuse, physical abuse problems, and genetic predispositions to diseases. We keep those things confidential and private because if that got out, it could affect somebody's life. And disclosure of such information can harm concerns person. We've talked about this, right? Social embarrassment or prejudice. When I was younger in the late 80s, early 90s, it was so taboo to have a diagnosis of HIV or AIDS, to the point where when Magic Johnson was on the basketball team for the Olympics, they didn't want to play, other teams didn't want to play with him because they were afraid if he bled on the court, they would get HIV or AIDS. It could limit your ability to get and hold a job. So what if you had a past history of heroin abuse? You no longer abuse heroin and you're just getting your life together and you're trying to get a job and your employers found out and someone said, well, they're a great candidate, but what if something happens and they start using heroin again? Isn't it just better if we move on to a different candidate without that even in the, horizon of possibility of chance? And of course, such damage can occur no matter whether the medical records are in paper or electronic form, right? So medical records contain information of the utmost sensitivity, yet this information is only useful when it's actually shared, right? So somebody's HIV status is really useful to know when you're taking care of them. It's good to know that as a nurse, even though we practice universal precautions, it is good to know when somebody is HIV positive. Just even because you want to know what kind of potential reaction someone could have to a medication, and HIV affects that. Physicians and providers need to know and should access complete medical records in order to help diagnose disease, avoid duplicative, expensive tests or risky tests or medication. And it also helps you design effective treatment plans. And as nurses, we need to know these things too because we share them with our providers. And sometimes patients don't know. They don't know when they got their colonoscopy last. They don't know that they say, oh yes, I had a pap smear, when really they had a pelvic exam. These are really important things for us to know as nurses. So the desirable sharing goes beyond personal care and includes relationships to society as a whole through the support of medical research, public health management, and law enforcement. So there are three concepts involved in protecting healthcare information. So one is privacy. We've talked about that. The right and the desire of a person to control the disclosure of the personal health information. Okay. Everyone has the right to control how that information is disclosed because we have the right to privacy here in the United States as patients. Confidentiality is the controlled release of personal health information to a care provider or information custodian under an agreement that limits the extent and conditions under which that information may be used or released. So you're like, oh my gosh, what does that mean? So controlled release means when that information is released, it's controlled by the person who owns it, of personal health information to a care provider. So don't forget, health information is also owned by the person, by the facility that took it down, and also information custodians. So what's an information custodian? That can be the patient, that can be another provider, that can be the patient's guardian, and it's under an agreement that limits the extent and conditions under which that information can be used or released further. So what are the stipulations that in which this information can actually be released? So security is the collection of policies, procedures, and safeguards that help maintain the integrity and availability of information systems and control access to their content. Medical records also serve a variety of functions for organizations not involved directly in care. So records are sent to insurers to justify payment for medical services rendered and to detect fraud. And they're used for quality review, administrative review, utilization studies to manage the business aspects of healthcare. So think about it. We want to know about how many people got Foley infections, right? And it's going to help and benefit everyone else. But what about that patient's information? They have the right to have their Foley catheter infection protected, right? So is it ethical to use that information if it's de-identified? These are the questions that are asked when it comes to technology ethics, informatics ethics. When it's used for societal purpose, like medical research or public health management. Okay, so some of you have taken my public health class and I talk about public health and trends and population management. So infant mortality rate. We use infant mortality rate all the time to rate a neighborhood or town or city and kind of set off an alarm, if you will, to what maybe that area needs to decrease infant mortality rate, right? So when you think deep down into it, though, does that infant not have the protection of their information, even if they're deceased? But also, wouldn't it benefit the public to know how many infants are dying early so that we can prevent that in the future? Social and service welfare system management, law enforcement, screening and licensing, and then of course determining life insurance eligibility. And then another area is education and medical training. So some of them make sense, right? Well, it's de-identified. We're using it for public health management for the good, right? Law enforcement. Well, is it fair to share it with the police information on someone who came in high on drugs? Or even if it's not fair, is it something that we can do? Is that going to stop people from coming to the hospital when they overdose? Think about those kids in Michigan who were too scared to report one of their fraternity brothers from overdosing on alcohol and falling and having a head injury because they were scared about the repercussions. Not to say that justifies what happened, by the way. So the standard view of appropriate use. So the standard view states that when adequate decision support tools are developed, they should be used as supplementary and subservient to human clinical judgment. Okay, so when we talk about clinical support and decision making, that's when you have your EMR tells you like, okay, your patient's due for an MMR, give the MMR. Well, if that person is pregnant, please don't listen to the robot computer. Please don't give them their MMR. That could hurt the fetus. So that's kind of that idea. It's subservient to your final human clinical judgment, although it is helpful. Corollaries of the standard view. So practitioners have an obligation to use any computer-based tool responsibly through the adequate user training and my understanding of the system's abilities and its limitations. Practitioners, so this is including nurses as bedside practitioners. You must abrogate your clinical judgment reflexively when using computer-based decision aids. And that's really easy to understand that. So computer programs should be used in clinical practice only after appropriate evaluation of its efficacy and documentation. So that takes time and money. Users in most clinical systems should be health professionals who are qualified to address the question at hand on the basis of their licensure, clinical training, and experience. In addition, software systems should be used to augment or supplement, not to replace individuals' decision making. So all uses of informatics tools, especially in patient care, should be preceded by adequate training and instructions. And we'll continue this in the next lecture.